Seeing folks that are jumping into the webinar right now to our Zoom meeting. So I'll just give it a second while folks are joining. Thank you all for coming tonight and joining us tonight. Okay, looks like everyone has jumped in. It's great to be with you all tonight. Welcome. Thank you so much for joining us. My name is Ryan Hampton. I'm the founder of the Voices Project. Welcome to our virtual town hall, Addiction and Mental Health Recovery, as we begin to come out of COVID. I'm grateful to see so many people, colleagues, friends, individuals impacted by addiction, people in recovery, providers joining us this evening. Thank you. Thank you for submitting your questions. Before we get started tonight, first, I do want to thank and welcome our participants. Former Congressman Patrick Kennedy, founder of the Kennedy Forum, Suzanne Kunis, Vice President of Behavioral Health of Horizon Blue Cross Blue Shield of New Jersey, Nick Boatman, Chair of the Board of the Nonprofit Discovery Institute, and Chris Thrasher of the Clinton Foundation. You know, I think it is important as we kick this off this evening that it goes without saying that the work that we're all doing together has never been more important. You know, just this morning, the CDC released its updated provisional overdose data for the 12 months ending in September 2020, which is pretty much right in the heat of the COVID-19 pandemic and lockdowns. And these numbers are certainly a grim picture of the work that we have ahead of us. They show that 90,237 predicted overdose deaths in that 12-month period. That is a 28.8% increase from the year prior. Again, this is another historic high in overdose fatalities. And sadly, I think that we will continue to see numbers like this as the CDC updates them in the coming months. So as we continue down the road towards recovery from COVID, as vaccines are becoming more widely available in communities all across America, and as state and local economies begin to reopen and resume business and operations, I believe that it's incumbent on all of us to do all that we can do to tackle this overdose and mental health crisis head on. So again, thank you all for being here tonight, taking time out of your schedule to join us for this important conversation. Many of you have already sent in questions, and we're going to try to get through as many as possible. I'll be serving as your moderator this evening. You can also feel free to send in additional questions using the Q&A feature on Zoom. You'll see it at the bottom of your screen. Feel free to send those in, and those will come right to me. So to kick off this evening, I thought it would make sense and would be appropriate if we went around the panel and each panelist had an opportunity to share kind of a personal challenge that they've learned coming out of the COVID pandemic that has, you know, furthered their drive, furthered their passion for the advocacy that they do in the addiction and mental health care space. And I think that tonight, because he's one of our guests of honor, we'll start with former Congressman Kennedy.
Well, thank you very much, Ryan. It's great to be with all of my colleagues and Chris with you virtually. Such a fellow soldier in this movement. I just want to tell you, Ryan, you have been the best. I mean, this initiative, the Voices Project, going out like we did today to sober housing here in this community where we're at in New Jersey, distributing naloxone, and not only distributing it, but giving people the how-tos in terms of using it, the ABCs. First, A, administer. Don't wait. Mm-hmm. And if you're wondering whether that's time or not, tell them you're about to give them a naloxone, and if they respond, then it's okay. But if they don't, then you know it's time. That's pretty simple. B, breathe. This notion that so many people are being lost, and where, as you said, 90,000, that a lot of them could have been prevented if not only we administered, but then we helped them with their oxygen just by breathing for them. And then C, then make the call. And ABCs. Let's keep these things in mind. It was amazing how many people at that recovery center They said they'd heard about naloxone, but they're a little sheepish and they weren't sure. They were so glad to get the demonstration. And when we're losing this many people, and to the other participants that you got to have there with us, Ryan, you had them go through the fact that the opioids that brought the two of us into recovery, I just said to myself, I'm so grateful that I got in recovery before the fentanyl started happening. Because as we heard from all of these people in the recovery house, it's all fentanyl today. And that expedites the risk factors for people to overdose. It's not your your father's Oldsmobile heroin. I mean, in fact, today it's a tough chance to find heroin that isn't laced with the fentanyl. So I just want to thank you so much, Ryan. I think it's so important that people who are following you on this webinar understand what you're trying to do in the States to get people motivated to take action, to stop this now. I mean, to think that these 90,000 people who were just announced today by CDC, we could prevent those deaths. Those are totally preventable deaths. Now, can we get them into treatment and then into recovery? But let's at least get them from dying. And that they don't even have access to this in many of the recovery places where there are the most people who would know who in their families or their communities needs that protection. And I want to thank the Clinton Foundation for making this a real priority, because the president's been terrific in just using his mantle to get pharmaceutical industries to make these naloxones more available. So I just say on a personal basis, I'm thrilled on the positive side to be able to go and Zoom with my fellows in recovery, day or night, 24/7. Never have had that awareness in recovery in all the years that I've been, and I'm happy Chris is on the phone who gave me my 10-year chip, and I could do that with my fellows all over the country at the same time. I had my old buddies from Rhode Island with me and everybody else. I think that's great. The downside is on my family. My little one's not a problem, but my teenager, this amount of time remote, away from her classmates, in addition to all the time that she had on technology to begin with, not a healthy thing. And so I really worry in advance of the coming waves of people who are prone to addiction, that we have a whole new generation that are going to be really vulnerable, because not only the more potent available drugs out there, but also because people are more fragile, if you will, because of what's happened to them in the course of the COVID experience.
Absolutely. Suzanne.
Sure. Hi. Thanks again for inviting me today. I'm really honored to be here, so I truly appreciate it. So for me, this has been, so I'm in the middle right now, quite honestly, of planning my nephew's memorial service. We will be doing that over this coming weekend. 35 years old, father of a 10-year-old daughter. He was a guy who was an amazing master craftsman. He could build your home without ever having to bring anybody else in. He was just unbelievable. But, he struggled for many years with drug and alcohol issues and wound up having a motorcycle accident in South Jersey. And fortunately, if there is such a thing, he had died immediately on impact. But he was high, and somebody evidenced the whole thing, and you could see the whole thing actually get ready to happen. So I watch him, and we've tried to help him for years. We were talking about this earlier. You can't, you can lead the horse to water, but you can't make them drink. And I said, this is what I do for a living. And how hard it is to have watched this happen to my family. Nobody is immune. And it's just, the stories just are deeper and deeper, and I look out to so many other people. I mean, when we have his memorial service, we're having materials with us because we know there are a lot of people that will be there that are either currently using or in recovery, and maybe we can help them. I'm trying to think about, can I get some naloxone to take and have it there for this. But it's just, like I said, no one's immune, and it is such a huge issue. And I work in an insurance company. I know everybody thinks the insurance company are the big bad folks, but honestly, we have committed ourselves, particularly I've been here for 4 years, to do everything we possibly can to try to change the dynamic out there. And we have embraced, I mean, again, as Patrick said, COVID has brought some horrible things, but COVID's also brought some great silver linings as it relates to the use of telemedicine and better engagement for kids in treatment and no-show rates that have dropped by 50% because people are doing virtual visits. I mean, there are so many positive things that we just have to hold on to and just keep building on. So, but thank you for having me here today.
Thank you. Thank you for sharing that with us. Nick.
Yeah, first off, thank you, Ryan. I'm very grateful to be here. We have some heavy hitters here and some great people on the panel, and thank you to the Clinton Foundation, for that donation and you guys rounding that up, and also the Kennedy Forum. Patrick, it was an incredible day that we had today. Suzanne, the Voices Project. These are people that are really making a difference in our community, and for me, what really, set things off, I mean, it was my immediate circle of people. I mean, this is something that we all struggle with. It's something that I've struggled with, my wife, my family. I've had loved ones, people that I know from recovery that have passed away, over this. And, the one thing that really sticks out to me is I had one of my best friends, and also he's an incredible advocate. I mean, this guy has touched so many lives, and the ripple effect that he's had in this community, over the past 10 years. It was a lot of isolation from COVID. So he was isolated. There was some unfortunate circumstances that happened in his life, and his mental health spun out of control, and it eventually led him to using. And this can be any one of us. And that really hit home for me, because this is a progressive disease. This gets worse, right? So we have to hit this head on, and we have to do something about this. Overdoses are sky high. We saw the numbers come out today. Mental health, and it's going to be a rough couple of years, and that's why we're all here, is to make a difference and come up with some solutions and make an impact.
Thanks, Nick. And Chris.
Sure, thanks. And thanks for having me here tonight, Ryan. I bring you greetings on behalf of our 42nd President of the United States. President Clinton has just been a real pleasure to work for because of his commitment to these types of issues and making sure that naloxone is accessible, it's available, it's affordable. So it's just so important. When I think about COVID-19 and some of the lessons that I've learned, as a person in long-term recovery like Ryan and like Patrick, I think about how, when COVID-19 really happened, it forced us who are in long-term recovery into isolation, which, as we know, doesn't mix well with all of the principles of recovery. And so to be able to pivot and basically bring all 26 million people in this country that are in long-term recovery together in a way that really has never been done before was an amazing feat. And to think of how quickly we were able to do it is also pretty incredible. But early on, one of the things that I very quickly realized is, the novelty of Zoom allowed us to do things that we probably have never done in recovery for many of us, which would be like Zoom into a meeting in the Philippines and then Zoom on over to London for another meeting. And what I sort of got worried about initially was, what about the local support network that we all depended on before COVID? What will happen to those people? Not necessarily the people in my immediate support network, but that secondary circle, the people that we might have only seen in meetings. We didn't have their numbers in our cell phones, but we knew them, we saw them. Where are they? Who are they plugged into? Are they staying connected locally? So, I had to come up with ways of trying to keep my local network together, and using technology to do that is something that I did. But, it was not without a challenge. And I think it still is a challenge for all of us to remain isolated, to stay safe, but to be able to stay connected. And I think, if anything, the 26 million, as I said, of people, that are living in long-term recovery, we've been brought together in a way that has never really happened before. The question is, can we now sustain that as sort of a community? Because, together we can do anything. And surviving the COVID-19 pandemic in recovery has been obviously a huge challenge. The one other thing I would say, and I just want to build off of something that Patrick said, is that, you know, with fentanyl, we're seeing things that, you know, we haven't seen before. The length of time that it takes for someone to overdose and die is so fast. In fact, I might even say that the C should come first, that we call 911 immediately. And then, you know, we administer and breathe, because, you know, I was just talking to a treatment provider here in Atlanta, the executive director, and she was saying for the first time ever, they are having clients come in now where their drug of choice is fentanyl. To you and I, that might sound crazy, but remind ourselves what it was like when we were using. I wanted the best. I didn't want anything cut with anything. So it sort of makes sense when you think about it like that. But we know, those of us who are working in recovery know that this is a game changer. That number, 92,000, is going to keep going up with fentanyl on the scene unless we have people like all the folks out there that know about naloxone, know how to recognize the signs and symptoms of an overdose, and know how to administer it. So once again, it's been great to you know, work with you, Ryan, on this project with Direct Relief. We are committed, and it's because of people like you that we're able to save as many lives as we have. So thanks.
Thank you, Chris. And I also want to say, you know, the last Patrick had mentioned in the beginning, Patrick and I were out in the car today, and we were out there with Nick and the Discovery Institute, who's our New Jersey partner. In each state, we had 5 pilot states, and here in New Jersey, our partner is Discovery, and we were out in sober homes and distributing this naloxone and getting it out there. And I want to just take a moment, and I cannot say, and it's not because, you know, of the personal connection, but as a foundation, I cannot say enough about the work that the Clinton Foundation has done on behalf of people in recovery and those in or seeking recovery and overdose prevention. You know, not too long ago, when through my own kind of story and losing my friend Tyler in a sober home, you know, reaching out to Chris, reaching out to the Clinton Foundation and laying this problem out. This is how real partnerships happen. They came up with the solution, and they said, we will help forge this partnership with Direct Relief. We will get naloxone donated, and we're going to rely on the recovery community to get it out there in the recovery homes. And that's exactly what we're doing. And I want to just put a kind of cap on this first question and say, you know, this whole trip and this distribution the last couple of days, it was about a month ago for me when I really realized we needed to be doing more. I mean, I knew we needed to be doing more, but it hit home. I lost my last friend to an overdose about a month ago, Mark. And when Mark's mom reached out to me, I was convinced it was an overdose, right? I was convinced. I knew he had been struggling on and off. But when she got on the phone with me and we talked for quite some time, she said, you know, Mark was struggling, but he couldn't, there was nobody to bring him naloxone. There was nobody to teach his roommate how to use it. He lost his job 6 months prior. You know, he was living in a trailer at the time when he died. He wasn't able to access, he didn't have, I mean, for us, it's great to have Zoom, but Mark didn't have Zoom, right? Mark was very reliant on in-person community and connection. And then she laid it on me that Mark didn't die of an overdose. Mark killed himself, you know, and he committed suicide. And I knew at that moment, we got to pull ourselves up by our bootstraps and get back out there. You know, this community needs us. So I want to thank all of you for coming together tonight and helping to make this happen. So we're going to take our first question from Philadelphia, Pennsylvania. It comes from Maureen. Maureen's question is, this is a tough moment for everyone, especially for mental health. It may sound silly, but the phenomena of social anxiety is more real and crippling than ever. How can we best support people reintegrating into the world outside of the home? And I am going to pick on Suzanne first for this one.
Sure. Thanks.
She's ready.
Actually, so yesterday I happened to see an article in the New York Times about sharpening up your social skills to get out there again after, as we start to reintegrate. And it's, very, 8 simple exercises, things to do, like go have a meal with somebody, blah, blah, blah. So there was, so there's a lot of consciousness about this, which is great. I worry about the little kids, and because I have a son who lives in London, and they were in significant lockdown, still are, and he went to a park to walk, and there was a woman there with her daughter, and the daughter was probably 2 or 3, and the little girl says, "Uh-oh, mommy, people," and we're thinking this kid is 2 years old, and she's terrified to see other people because of everything that you have to go through during the lockdown and everything. It is going to be a long road from here, and I don't know that anybody has the answer. There's no silver bullet here. It's going to take 1 million people and lots of work to try to do small but steady steps to actually help people to reintegrate. And like I said, I wish there was a magic bullet here, but there isn't. And I think that's the way we're all going to have to do it. But we all have to do it together. And especially for people who are in recovery or who are trying to get into recovery and don't have necessarily those kinds of support systems in place today. And we all need to be there and to help them and hold hands and go have those meals together and go and be places in public together and start trying to get people talking again. But that's really kind of where I sit at this point.
Can I follow up
Yes.
on that? And we need to bring mental health into every public school in America. And
Absolutely.
now with, telehealth, there's no reason why we couldn't have, if we could get CMS to reimburse for it. On site of service, every public school can allow their kids in that population to be able to access mental health. That should be a priority for us right now.
Absolutely.
And, the American Recovery Act has money for, quote, going back to school, and so much of it is focused on the numeracy and literacy. Every expert out there I talk to says it's the socialization that is going to be, to your point, to this question's point, going to be the big key for these young people to overcome. And we need more people in those schools to embrace those kids, not less. And we need to embed social emotional learning. I'm going to just be clear about this. When they start their school year, they get their eyes checked, their hearing checked, their scoliosis, they
Correct.
check for meningitis, did they get their vaccinations? What are they leaving out? They're leaving out the most important organ of the body, the brain, and that filters all their ability to learn. Why aren't we doing, depression, anxiety screenings, trauma? We know ACEs, adverse childhood experience. This whole experience has been an adverse childhood experience.
Exactly.
So I think this is a watershed moment. I think really we could redevelop our whole education system. If you know about education, it's where the young people are. And where are these illnesses? Where the young people are. And learning how to cope. And of course, you say, I'm a new father. It took me till 40 to figure out I could have a family and be responsible for others. Who gives you the handbook? Like, how do you teach this? And if I weren't in recovery, I don't think I'd have as many tools as I have now. But we all need these tools, coping mechanisms, how to mediate. It's all cognitive behavioral therapy, mediate our feelings. We learn that in recovery. But we need to make this available in a ubiquitous way to our kids as part of education, because if they can't learn that, how can they learn anything else that they're being taught?
Could I just add to that, Patrick?
yeah.
Because I also think about the parents.
Yeah.
Because we're going to have kids in school, and we're going to do all the work with the kids, and a couple of things. One, how do we help parents? Because parents don't know how to have conversations like they need to with
That's
their
right.
kids. That's number one. The other thing is, what happens as issues are filed? There's the scope of capability in terms of psychiatry and other behavioral health clinicians. We have to really look at how we expand who that real treatment team is to help people so you get them early so they don't turn into patients that have long, and this is a chronic disease. And everybody has to buy in and accept that, because that is the reality of the world. but let kids today can talk about things better than they used to with their peers, but parents have to be able to get comfortable with that.
That's right.
And you talk about screening. I mean, every annual physical that happens in this country should have a component of a mental health screening attached to it, and not just don't ask me my 2 PHQ questions.
Right.
That's not even close to being enough. We got a long way to go. But again, lots of voices coming out and trying to drive this.
Well, what I'll just finally say is, Ryan, you're really pushing in all these states for people to become advocates, because these are not novel ideas, but we need them to bring them to their state legislatures, to their mayors, to their local county officials, to their governors, and so forth, that we need capacity. We need capacity. You said there's just not enough people. And as you know, Chris, when you said 26 million people in long-term recovery, how do we get them? You know, my uncle, President Kennedy, made the famous quote about ask not what your country could do for you, but we could do for your country. We need that call to national service amongst those of us who have been blessed enough to know that our own survival is contingent upon helping other people survive. What a beautiful thing if we could have these recovery cores like you've been working with, Ryan, around the country. It'd be great if people knew more about those recovery communities and the recovery core. I love the sound of that, and we need it for sure.
You know, I want to add into this that, you know, the principles that we talk about often in recovery are universal, and they can be shared with our kids that are struggling with mental health, you know, challenges at home, being isolated for the last year. You know, it reminds me that we, kind of the royal we, if you will, are all in this together. You know, the principle of unity, and reminding ourselves kind of on a daily basis that 1 + 1 + 1 is far greater than 3. And that's so important. I think that, you know, baby steps really is the principle that I would incorporate here, much in the same way that, you know, if I had to think that I had to do, you know, anything like all at once, it would be, you know, really overwhelming for me. And, you know, I learned early on in my recovery to break things down into manageable kind of chunks. You know, it's like that African proverb of how do you eat an elephant, right? One bite at a time. You know, how do I live my life? One day at a time. And the truth is that, you know, I can share those principles with my kids. You know, I have watched my kids deteriorate. I have two, a 14-year-old and a 17-year-old. My 17-year-old has been in the hospital twice and in a long-term residential treatment center for depression, anxiety, over this time in COVID. And I watched it happen. She was not exhibiting any signs of depression before COVID. So this has all been as a result of, and I know that I am not unique. I know that our kids are challenged right now. And so, you know, I've been trying to share as much as I can about some of the principles that I've learned in recovery with my kids, with my family, because it is so important and it's so practical. You know, I can do this today. I don't know about tomorrow. I don't know about next week, but I can do this today. Manageable chunks. So.
Absolutely. Nick?
Yeah, I think, you know, there's a lot of really good points here, and we're going to have a lot of adjustments for people that are going back in the community, and that's, you know, anxiety, mental health is a very real thing, and a big thing of that. The opposite of addiction is connection, right, and community, and we need, that's why
Johan
vaccines.
Hari, by the way.
What's that?
Said that. Johan Hari.
Yes, and, you know, that's why vaccines are so important right now. I think, don't quote me on this, but what, the state's around 25%, and we need to continue taking those. I think you said it earlier today, Patrick, that, yeah, we have a pandemic right now with COVID, but if COVID wasn't around, the pandemic would be overdose, right? Addiction. What's happening right now? And I completely agree with the screenings. We need, you know, a full comprehensive treatment model. So when people are going for their vaccines, when people are going to their primary care physicians, when people, you know, are going to the ER, they need these mental health and substance use screenings. And, you know, I think peer involvement would be a fantastic thing that we need to do. As I said earlier, this is a progressive disease. It's kind of like if we don't nip this in the butt now, you know, what happens? It's like somebody that has a toothache, right? If you don't address it right now, well, what's going to happen down the line? You're going to have a root canal, or you're going to end up having surgery. So we need to implement the screening process. We need to get peers involved, and I think that'll make a huge difference.
That's a great run up to our second question, coming from Chris in Trenton, New Jersey, here in New Jersey. Um, Chris's question is, what touch points can SUD, substance use disorder, and mental health providers use with respect to COVID vaccine distribution and testing that will help curb overdose and suicide rates? I'm going to take a point of personal privilege really quick and throw my opinion in on this. We should be handing naloxone out to every single person. And then I will kick it to Patrick.
Well, I talked enough in the last question to fill up both questions, but yeah, no, I mean, I really think we missed a historic opportunity to fix the original sin of our current healthcare system, which was having mental health be thrown out of the house of healthcare. And everyone knows that this is such a pandemic, public health. It would have communicated if on our national level we had said, you know, you're not going to get free with just a vaccination.
That's right.
Right? Yep. You're going to need to get mental health. Everybody's going to need it, so don't think you're special or worry about being stigmatized or identified, because it's our national priority to say, just like getting a shot in your arm for your vaccination, we're also going to do these things to help you prevent, because of course we're at a point now where dependency on alcohol and benzodiazepines and everything else that people are starting to use too much of over the COVID, that may not be addicts yet, people with addiction, those things could become addiction, right? That's the challenge for early intervention now, is that we need to make this a national priority for everybody. So that's what I would send. I have to say, as a psychhub.org, we've managed to put together a whole list of materials, videos, articles, and everything else that really we're distributing at vaccination sites for the states that have bought the material. It's really just to cover cost, but we should have had a more formal, like, mass unit outside these mass vaccination sites to communicate to people that it's not a one and done. You have to have both. And but the next best thing is we need to get people to know that mental health is mental health, and there's no health without mental health. And COVID's impact ultimately could end up taking more people's lives, as we're seeing from these recent CDC numbers, from the impact of COVID than from the actual virus itself. And we need to be mindful of that, so that our CDC and our HHS and all of our other agencies start to wake up to the fact that they need to be putting more resources towards this, or commensurate resources towards this, like they've been doing with COVID.
Yeah, one of the things, I'm sorry, go ahead.
No, I was just going to say, Patrick, you're touching on stigma also, we must work together to address stigma. That old saying, it takes a village. This means that communities have to come together in a new and different way. I mean, think about community, the fabric of, healthcare professionals, providers, parents, teachers, families, public policy makers, researchers, law enforcement. I mean, the list goes on and on, right? It's really the fabric of our community. Might I even suggest that much of the work that we do, it is even the faith-based community that is often overlooked, and I think it's the glue that holds many of us together in our communities. Here's what we know. We know that substance use disorders have complexity, and it needs a cultural shift, if you will. But, we also know very well that this epidemic cuts across all demographics, as one program says, regardless of age, race, sexual identity, creed, religion, lack of religion. These are affecting all of us. And so it's going to require all of us working together. COVID-19 is no different. It requires everyone. So, I always say, know who are your community influencers. Invite them to the table. Radical inclusivity is a commitment, and it's a principle. I always say, if you're not at the table, you're on the menu. Bring them to the table. Everyone has a part to play in this thing. But we all have to be willing to come to the table and have the conversation. Stigma and education. Education is the number one thing, and it's the only way that our lawmakers are going to change, is if they're educated.
Well, I would just add to that. I oftentimes say, stigma is like public enemy number one, right? Because when you look at how dollars are being doled out for COVID, like that's how you deal with a true public health emergency, right? You marshal every single resource available to the federal government, available to state governments, available to municipalities, and you deploy it, right? But it feels like with substance use disorder, with overdose, with suicide, right? We're nowhere near that right now. And that's because I have a theory, but I'm also very political on this, is they don't see them equal. We talk about them very well in talking points that they're equal, but they're not treated equally.
Yeah,
Suzanne.
Yeah.
Sorry, Nick.
Go ahead, Suzanne.
All I was going to say, just two things real quickly. One is I was really disappointed when I saw the list come out of the people who were eligible to get the vaccinations first. And I read down the entire list, and nowhere on there was there anything about people who either had mental health challenges or substance use issues. And I thought, this is it. This is exactly what's wrong here, because we don't view this like a chronic illness like everything else is. And I think that was horrifying to me. And I kept saying to someone on Patrick's team, what's he doing about it? But I didn't get an answer. The other part of that is on stigma. Stigma, you all have hit it on the head, obviously, but the thing that to me is, again, one of those kind of silver linings is when you start looking at some of the data that's out there and some of the surveys that have been done, we're seeing excess of 50% of the adult population saying that they are depressed and anxious and in need of help. And that's the first time I've seen numbers like that, to make it kind of, to try to normalize this whole thing, to say we all live with this. And this is something that we all need to pay attention to, just like we do the diabetes and the high blood pressure and everything else. So thanks. Sorry.
No, that's fine. I actually really like this question because, yes, I'm, we got to break down the barriers to treatment and to mental health. We all know that. And yes, I'm the chairman of the board at Discovery Institute. I also have a treatment center out in the Midwest in Missouri called Sauna Lake Recovery Center. And what we did out there with a few other partners, and my team and I, what we worked on, we opened up what's called urgent access centers, okay? So the theory behind this and what we've done, we've seen a couple of them populate over the country, and I encourage everybody to look at this model, is we almost took an urgent care model, right? And this is attached to our outpatients. And we made easy access. So anybody can walk through those doors and get immediate access to a psychiatrist. We do rapid bube access to Suboxone. We give out Narcan. And we have crisis interventionists there. It's about meeting people where they're at. And, if you look at...
like a minute clinic.
Yeah, but,
mental health.
In Missouri, it's taking people, it can take 60 days, 90 days to get a psychiatric appointment. That's unacceptable with where we're at. So you get those immediate services, and we meet people where they're at, mental health, substance use, and then we have crisis interventionists there, right? So maybe they're not ready for treatment today. Maybe they're not ready to take that next step, but next time they come in, okay, are you there? Are you ready to do this today? And it's been incredible. I think we've helped a lot of people that wouldn't otherwise maybe have gotten the help. And we've distributed a lot of Narcan and a lot of resources. So that's a model that I think we should be looking at across the country.
Definitely all about no objections to innovation from this side. I think we need more innovation in this space. So thank you for that. Next question is our first anonymous question of the evening, but anonymous from Michigan. And that question is, how can we get Medicare or Medicaid, to start paying for the full substance use disorder continuum of care? And I know Patrick will like the second part of this question. And what role will parity enforcement play, given the demand for addiction and mental health services is expected to be at an all-time high because of COVID? But I'm going to mix it up, and I'm actually going to give Suzanne the mic.
He was perched up. He was ready to go.
No, she would have liked what I had to say. Actually.
All right, then let him go first.
Okay.
No. I mean, we are entering a revolutionary period of time where CMS is moving fast towards value-based contracting, which means instead of giving me the service, get me the outcome. And that's what we as consumers should want. You know, they're doing that all across the country. I'm seeing models of this everywhere. And I think that might mean that we spend more on mental health. I don't want just what you might give someone else on it, which is what I fought for, and the law says you give me at least the same. We might even want more because we now know the interrelationship between good mental health and good physical health. And we've quantified that. And so total cost of care, if the dollar is on the line, they're going to start spending more on something they've never spent before on, and that is mental health, because the returns, if they're liable for your diabetes cost and your cardiovascular disease and my asthma, and the fact that I've never had to visit, and I'm covered by Horizon. I've never had to be in an ER in the last 10 years of recovery, and yet before I got sober, I was regularly in ERs for contusions and lacerations. I had irritable bowel syndrome. I had back pain. I was a chronic frequent flyer. And Horizon, they owe a check to my local trudgers 12-step recovery group, because that group has saved Horizon Blue Cross New Jersey an untold amount of money. But that also shows, for everybody listening, it's recovery. You know, we got to figure out a way to move those resources to provide that support for people so that they're not just being treated on medical and they get released and then they have no support after that, which is why we need to marry both what payers pay for and what we as who know it's only through helping each other that we get better.
Okay, you could have stopped about 2 sentences ago. But so, and I'm glad you brought it up, so I should give you $5 because, and you know this, here in New Jersey, what we've done is one of the greatest challenges we have, there's like a laundry list of challenges for mental health and substance use in this country, much less in this state. And one of those pieces is the fact that people that need help, let's say you go to a rehab and you're being discharged and tomorrow you're supposed to show up for an intensive outpatient program. And if you don't show up tomorrow, no one's going looking for you. And that's one of the many, many, many links along on this chain that have never been connected or not being connected. What we've done is we actually started a pilot project here in Monmouth County, actually. And it's when we start looking at individuals with substance use disorders or even with serious mental illness, they're not going to get primarily treated in a primary care practice's office. That's not where most people feel comfortable. But where we saw a huge value is in community mental health. And when we started working with, the CCBHC model is phenomenal as far as I'm concerned, and so many others in terms of the scope of services and the availability of services. And what we did is we contracted with a provider here in Monmouth County, CPC Behavioral Health. I'll give them a plug. They're amazing. And what we've done is saying, look, we're going to give you money, and your job is for anybody who we can identify through data or gets referred into you. We want you guys to actually embrace those patients, navigate those patients, get them addressed from not just their behavioral health perspective, but what are their physical health issues? What are their social determinant issues? Do they have a roof over their head? Because if nobody has a roof over their head or a bed to sleep in at night, none of this is going to work.
That's right.
And so what we did is we paid them to do nothing more than embrace these people, follow these people, go to appointments with them, be feet on the street to them, available 24/7. And we did this for a year, and 500 people went through the program in the year. And we, again, are huge believers, anybody wants to believe, but it's the fact that if you invest in behavioral health services, you will win in total medical expense. And within my organization, I basically said, look, our goal is, yes, we'll see total medical expense reductions because the nice thing is it'll translate into premium reductions for people. But even if we save 1 penny or no pennies, but we don't lose money, we've done the right thing for people. And so this program that's been up for a year has actually had tremendous outcomes. Patient self-report, which to me is huge because that's where hope is. When people feel good about what's happening and they see fewer emergency rooms or admissions, or I haven't had a drink in 30 days or 60 days or 90 days, they feel good. It's really an indicator of what the future is going to look like for them. And so we had such success in the first pilot that we are now expanding this around the state. And so by the end of this year, beginning of next year, all 21 counties in New Jersey will have this model up and running. In addition to that, we've been out talking to people around the country, and everybody we talk to is interested in doing something similar to it. And there are a lot of different models out there, but we thought the population we're dealing with right off the bat is commercial right now because Medicaid in New Jersey is handled differently than it is in other places, which is fine. And we want to show the state, look, this really works, let's do it together. But it's really addressing a whole person, not just a piece of a person. It's addressing everything from front to back and really making sure that they can get to treatment. They have a ride, they've got a house, or someplace to live, and people care about them. So anyway.
So let me say,
And
there's that quote, see the light and feel the heat. We need both. So to the point on the parity, there's some major payers who are still disregarding medical management practices that are based upon, evidence-based, science approach to diagnoses. So those standards have not been met, and that's where parity can really be helpful. And parity can be helpful on the in-network stuff. We really want to make sure people have adequate time to get that access like they would their diabetes care. And so, but I think that there is a confluence of both positive for the payers to go in the direction, but we can't let up also on the regulatory side because it's part of the protecting the public health.
Yeah,
I wanted to add there that, parity is the law and addiction equity, right? And in large part, we have Patrick to thank for that. But I want to touch on something, Suzanne, that you said, which you really talked about the public health approach. And, I think all too often in public health, the debate centers around harm elimination versus harm reduction. And you can look at any of the public health challenges, HIV, AIDS, needle exchange, sexual health, obesity, whatever the public health challenges, whenever there seems to be in public health this idea of an implied choice, like it's a choice, stigma is front and center. And so, we see this currently right now in COVID-19 with the weaponizing of a simple piece of cloth over your face to protect your brother and sisters from contracting. We know this stuff. We've known it for hundreds of years. But whether we're talking about individual stigma, which keeps the people who are experiencing a problem from acknowledging the problem and seeking the help that they need. There's family, there's community, societal stigma. Though, that type of stigma keeps people from recommending the help or acknowledging the problem for, family and friends. Or, all too often, I think it's in the policy arena, right? Where stigma keeps government and the private sector from addressing the problem as a whole. So I think, I hate to be like, repetitive, but I think we have to attack stigma from all angles, whether it's upstream at the governmental level, whether it's midstream at the community, or downstream at the individual level. Stigma must be addressed. And I think that, Patrick, with the law, that you helped to shape with mental health parity and addiction equity, I mean, we have the law on our side. Now we have to hold people accountable to follow the law. And until we advocate for that, now I know this because I know the law, and I still had to advocate for my daughter to get approved for residential treatment. And guess what? Every 5 or 6 days, I had to make another call. I had to be on the phone and tell them why. Why was this important for her to stay in a residential treatment facility? And I know how to talk to them to get around it. What about all the folks that don't know how to do that? How are we going to help them? So we have to come together. This is what I mean when I say bring a community together. Come together, educate, inform, to be able to work with the payers to say, hold them accountable to the law. Because if we don't hold them accountable, I can promise you they're not going to pay. They don't want to pay.
I don't want to get in trouble for this, but I will say, and I know some are listening, not President Biden himself, but some folks on his team, I think there are some things that the president certainly could do through executive action on parity, and I hope that he does. I think that it's something that needs to be tackled immediately in 2021, not just on the federal level, but also on state level. And I think there's a lot that governors and insurance commissioners can do as well. Nick, you were trying to get a word in.
Yeah.
To know about.
Well, I really like what Suzanne had to say there. I want to learn more about some of those pilots that you're running. And, what I really took out of that, it's all about engagement, right? Engagement and long-term engagement. And, going back to the question on how do we get Medicare or Medicaid to pay for that full continuum? Well, they're paying for each level of care, but there's two hurdles that I see here. One of them is the cert time on what Chris talked about, right? You got to constantly go through the UR process. So it's making sure that people get the time that they need in the appropriate levels of care. But even more importantly, it's housing. So I'll speak for New Jersey on what I see on the Medicaid end. If somebody comes into treatment and they're in a rough environment, toxic home life, beaten up, battered, nobody in their pocket, and they go to treatment for 14 days, 30 days, and they have no safe place to go afterwards, what are they doing? They're just going back to that same environment, and they're prone for relapse. I mean, we're asking for it, and we have to change that. And with the long-term engagement, you add in peers, right? When you have a peer recovery support specialist that's following somebody from the gate, from the door for at least a year to two, well, then they're calling them every week. How are you doing? Are you following up on your medical appointments? Are you going to outpatient treatment? What else can we help you with? Do you have a job? Can we help you with employment? What are your goals for your treatment plan when they're in the driver's seat making those goals and helping them and supporting them to those goals? But, I think we're shooting ourselves in the foot if we don't look at taking some of these funds and applying it to housing. That's how we're going to get outcomes. If we want this value-based, we want outcomes, because outcomes is everything. That's what comes first. We have to give them a safe place, and we have to, for this full continuum. Because when they go back to that toxic environment after 14 days, and we want them to go to virtual treatment, it's just tough, and we're not going to see the results that we want to see.
And I'll just jump in you always tee up the next question. We have another question, and it's about housing. But before I get to it, look, I always preface this by saying that treatment saved my life, medication saved my life. I was lucky enough to have access to it. Treatment and Medicaid actually saved my life because Medicaid paid for my treatment. But what really has sustained my recovery, particularly in the first 18 months, something that I had never had before after multiple attempts at treatment, was safe, stable, qualified recovery housing. Recovery housing was the game changer for me. So I can't say enough about housing and building.
Yeah, but Ryan, let's tell people what's really going on out there, because it's fine to set really great standards, and we all want better standards, better quality, but we need access. I mean, right. I don't want to lower standards, but at this time, if we're only saving less than 5% of the population has access to it, but it's good housing, right. We got a problem. So, we're trying to do a lot of things at once, but we have to be mindful that, something's better than nothing. And right now, the irony is you're going to get nothing if you're all about, it's got to be so licensed here and there and there, and it's going to preclude people from going out and being able to access it.
Yeah, we can't reduce capacity by throwing up severe barriers for people from opening recovery housing. I think that there's standards. SAMHSA, for anybody that's interested, SAMHSA has really good standards. States can really play a big role in implementing the standards through certification process. And actually, it's kind of our hope in the advocacy community that some of this American Rescue Plan money, can be used to help the states kind of set up an infrastructure to follow best practices and standards. But we can't, certain states have implemented pretty harsh licensing up front, and it has kind of diminished capacity very quickly. And we have to be mindful of that.
Well, speaking of capacity, I just want to thank you, Ryan, for all you're doing on the major opioid settlement issues. Trying to get those dollars to go to support recovery organizations and recovery communities, or even to build an infrastructure of sober housing. Can you imagine what a game changer if you were able to make that investment? That's really would be a positive down payment on addressing this crisis. And I know how much you've been beating up on Purdue and others regarding trying to get them to put some money aside for infrastructure like sober housing, which is so crucial to this whole challenge.
Which I mean I could go on forever on this point, but it's one of the reasons, and one of the outcomes, the work we do at the Voices Project, and we try to encourage folks at Discovery and have done a lot of great work with Clinton Foundation and there's a lot of national organizations. We had a recovery appointments project this year when President Biden won to try and get recovery people appointed into higher level offices. People with lived experience need to be at the table for these decisions, right? Because if they're not, there is zero substitute for that lived experience, right? Like, no disrespect to the folks with the alphabet soup next to their name, but it's not either or, it's both. And I think that historically we have not seen that. I mean, and Patrick, you're kind of an exception to the rule because you have a little bit of alphabet soup in terms of like former member of Congress next to your name, but we need folks who are running recovery community organizations, folks who are involved in treatment and prevention and harm reduction and family services. Like, they should be sitting on boards and commissions and opioid abatement, commissions, because they have a different perspective. And usually their ear is closer to the ground of what's happening in their own community.
Well, Ryan, can I say something here about the
Absolutely.
housing issue? Because, it really comes back to something that we hear very often, which is, that whole idea of changing the mindset that addiction is not a moral failing, right? But a treatable disease, I think, is and remains key to fighting and beating this thing. But I think that we have to remind ourselves and recognize that the brain is just another organ in our body. And just the way that things can go wrong with the heart, the lungs, the liver, the kidneys, things can go wrong with our brain. And I think we have to be able to talk about that in a non-stigmatizing way. And, housing, I mean, it's education, employment, housing, and human connection. I always say those are the four things that, recovery is all about. And in public health, we often talk about the social determinants of health, which is, where we're born, where we live, where we grow, where we play, where we work. That affects how we experience health. And housing is a huge part of recovery and part of the continuum of care model that, reinforces promotion, prevention, treatment, and recovery. And, I just think that it's all imperative, but it's all about leadership. And I think that, if there's anything that I could say tonight to the people watching is, you are leaders, because leadership responds to opportunities, it responds to challenges, to crises. And leadership is not position dependent. So we need leaders. We need people to be advocates. 26 million strong we are if we work together.
And I have a whole bunch of more questions coming in, but we are running out of time. I want to give each panelist just a quick, 1 minute. If you have a closing message for everyone who's watching here on the Zoom. Also, anybody on the Zoom, you can know that this is also being broadcast on Facebook. If you want to share it with family members or colleagues, you can find it on the Kennedy Forum Facebook page, Patrick's Facebook page, also the Discovery Institute. It's being broadcast across all three pages. And just for a closing thought for our audience tonight, we'll kick it off with you, Chris.
Well, I just kind of said it. I'm just going to say leadership is too important to leave its emergence to chance alone. We have to create the next generation of leaders. Great.
Thank you. And Nick.
Well, I'm just grateful. I'm grateful to be here. I'm grateful for, everybody on here being leaders, everybody at home. I agree with you, Chris. Everybody's got to do their part. We're in this together. And, we're seeing the ripple effects right now from COVID. This was way before COVID happened, but it's making it so much worse. And we need calls to action on these. We have to, or, we see it every day through our treatment centers. There is a stigma with addiction, but these are mothers, these are fathers, these are our teachers of our children, these are our healthcare workers, this is our community. And if we don't do something about this, implement screenings, engagement, long-term care, change our model, change our way of thinking, then we're not adapting, we're not moving forward. And this is a new time. We're in the middle of, this is unprecedented times right now. And even though there's been a lot of negative with COVID, there's also been a lot of good. And it's given us the opportunity to see things for what they are and adapt and change. And Chris said it earlier, we have to pivot. So thank you. I'm grateful for everybody.
Thank you. Suzanne?
Sure, thanks. I just want to say, unless you're living under a rock, every person that's on this call, every person out there is in fact affected by this. Your family members, your friends, your work colleagues, there's no denying it. Why, we'll get together for so many other reasons. Why can't we get ahead of this thing? It is, the forces are out there that can really make a difference, and it's gonna take the village, right? Every single person, all of us from all different walks of life and different industries, et cetera, together to try to make a difference here. Because if we don't, I can't even imagine what this is gonna be like for our kids or their kids going forward. So now we have to do it now.
Yeah.
And thank you, Susan, because I think that the CCB, Certified Community Behavioral Health Center model, is a fantastic holistic approach to treating the whole person. And it's great to see you as a private payer bring it out to every county and as a model for the country. It just shows that each of us has an opportunity in our own lives to make a difference. I was blessed. I had a famous last name. I could use it to try to do what I could. We all are doing, you're taking your recovery, you're leading it and passing it forward. And Chris and Ryan, you guys the same. This, I think politics, and I mean both Democrat and Republican, we need to get people more engaged in the politics so that we now have more curated issues for everything from housing and education and healthcare and criminal justice and prevention, continuity of care and everything. We've got it all mapped out now, but now we need foot soldiers to go to the state houses, to go to the Capitol, to go to these public hearings and make the case, because you now have an agenda. The agenda is more detailed now than it's ever been before, and there's more on the line, as everyone has said. So please step up. We have a huge opportunity to take this tragedy of COVID and turn it into a watershed for mental health for the future. This will be the pivot. If we don't take this opportunity now, we're going to forsake a lot of lives in the process. So thank you all for tuning in tonight, and keep plugged in.
Thank you, Patrick. Thank you, Nick. Thank you, Suzanne. Thank you, Chris. Thank you to your respective organizations for the work you're doing, and to everybody who's tuned in and watching on Facebook. Thank you all for what you're doing. You're all partners with us in many different ways, and hopefully, sooner rather than later, as vaccines continue to roll out, we will all be able to be together in person soon. So thank you all, and feel free to, you can reach Patrick on social media. Same thing with Discovery Institute. Follow the Clinton Foundation, our work at the Voices Project. If you're interested more in our Overdose Response Initiative, if you're here in New Jersey, feel free to reach out to Discovery to become a partner. If you're in another state and would like to be involved, feel free to reach out to me through the Voices Project at voicesriseup.org. Thank you all very much. Please stay safe and healthy out there, and we'll see you soon. Bye.